Paris, about 46% of the United States population is fully vaccinated, but many countries have shown lagging vaccination rates. As the demand for vaccines wanes in the United States, President Joe Biden recently announced a plan to distribute vaccines worldwide.
We're taking a major step that will supercharge the global fight against this pandemic. In my direction, the United States will purchase an additional 500 million doses from Pfizer vaccine, that will donate nearly 100 low and lower middle income countries. They will be the beneficiaries.
Now joining us is Tom Hope, professor of cell and developmental biology at Northwestern University. Welcome, Professor Hope. So we know that President Biden's plan calls for distributing 200 million COVID-19 vaccines by the end of 2021, 500 million vaccines to be distributed by June 2022, and as he just said, that is to 92 countries with low to lower to middle income levels. Professor Hope, what more can the administration do?
I think that they have to try to come up with some creative ways to get this done. The problem is that we're talking about billions of people, and the numbers we were just talking about were up around 100 million or even a half a billion. But we have to get this done quickly. We got to see this amazing display of how the vaccine stops the virus right here in the U.S. We've got to finish that job, but now we've got to vaccinate the world as soon as possible. This isolate, the Delta isolate variant is probably transmitting 10 times more efficiently than the original virus. And so if we let this virus have chances to mutate, it could start to evade the vaccine.
What areas of the world are lacking most in vaccination?
My understanding is that, for instance, in Africa, I think they have only vaccinated about 1 or 2%, and they're really struggling to even find places to try to get the vaccines if they can, find the resources to collect them. So I think that Africa is a place that it's been a bit of a blessing that the virus really hasn't taken off there. But we're unfortunately seeing the virus taking off in places where it didn't really get a hold over the past year, and so again, we just have to come up with ways to get the resources to get this done. We have to do it as a population.
What are your concerns, or what is causing the barriers in getting access to these vaccines for those countries?
I think part of it is just being able to produce enough. I think they are producing a lot, and I think that unfortunately, a lot of times it comes down to resources, it comes down to money, and really that should not be the question at this point. Those are investments we have to make for the world, for ourselves, and we've got to get the other vaccines that are being developed and optimized online and out to people. There's a lot of work to be done.
What are your concerns about countries, as they fall behind in vaccinating against the virus, that the virus mutates even further as, we already know that the Delta variant is spreading?
Yep. So my primary concern is the variants that we're seeing. They pop up and they take over because they can run faster than the next virus, and they can sort of spread faster. They can overtake it, and that's sort of a pressure the viruses have with each other. As we roll out the vaccine, and the virus has a chance to bump into somebody that's vaccinated, but then also somebody else that isn't, and can start to try to go back and forth between a vaccinated individual and a non-vaccinated individual. That's the circumstances that can lead to a variant coming up that then sees it has an advantage and can infect vaccinated people.
What does this vaccination gap say about, the global public health inequities that exist?
I think it puts it on the table for all of us to see without any fancy dressings. Um, um, this unfortunately has been something that's part of the world, maybe getting a little better, but during the pandemic, it was sort of very obvious. And I know myself, many people were hoping that some of the lessons we learned, we have had a chance to stop and think, a chance to organize things better, make things more efficient. And we still have a chance to do that. And this could be a good reason to do it. But it just will be sad if we go back to some of the bad habits and unfortunate things that were common in our lives before the pandemic.
To that end, is this an opportunity to learn and therefore prevent this, this vaccination gap from happening with future global vaccination efforts?
Yeah, I would answer to that is yes. This has been the most remarkable, eye-opening learning experience for someone who's been studying viruses for 30 years. Because this is to watch it all unfolding in real time is something else. And it's kind of amazing that we didn't know this virus existed, a year and a half ago, and the country's now vaccinated pretty much. We have to finish that job, but that is something that's quite remarkable. And what we learned from that is next time we'll be able to do better. So, but we have to stop these things early. There's a bunch of things you can do to keep it from becoming the big problem it became, and that's the things we have to learn.
Okay, a lot of work. Our thanks to Northwestern professor Tom Hope for joining us.
Thank you very much.